Good afternoon, everyone. We will wait just a minute or so while everyone gets logged into Zoom for the webinar.
All right. Good afternoon, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on April 5th, 2021, and is scheduled to run from 2 p.m. until 3 p.m. I want to thank you for taking some time to join us for this Monday edition of our webinar series. My name is Stephen Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. Before I cover a few updates and get into the agenda, I want to get back on my soapbox, so to speak. We continue to see, even since we last had our webinar, disgusting acts of racism against our Asian American and Pacific Islander brothers and sisters. And the trial of George Floyd's murder is a painful reminder that racism is alive and here and now. We need to get to a place and continue to work to get to a place where misinformed, misguided actions such as these are a thing of the past. I hope in the webinars that come, even though this is something that we continue to work on, that these reminders, we just need to get to a place where these are a thing of the past. On a better note, I do want to acknowledge this last week, on Wednesday, March 31st, we recognized Cesar Chavez Day, a day where we honor the civil rights activist who was such a powerful figure in the labor movement and whose legacy lives on. We marked that as the state of California. We hope you were able to as well in some form. I'll turn us back now to the webinar and cover some brief updates. Regarding the CCDF state plan, we've covered this in a couple of webinars in the past, but some of the later updates that regarding the Child Care and Development Fund state plan. CDE, as the lead agency, is required to submit a state plan detailing how funds, the federal funds, are used, and then to continue to be eligible for federal funding. So towards that effort, CDE this last Tuesday held a virtual public hearing to receive public comments on the draft of the 2022-24 CCDF state plan. If you were unable to attend this public hearing, any interested individual may still submit written comments on the draft 2022-24 state plan to the state plan email box. With that, I'm going to ask Brittany if she could put a link to the CCDF state plan webpage in the chat, as well as the email address to submit any written comments that you would like to provide. And I will turn it over to Erica now for some words.
Thank you so much, Steve. If I turn off my camera, please, it's just I'm making sure that my internet says it's unstable. They said if I turn off the camera, it will be better, but if not, I'm still gonna leave it open. So thank you, Steve. Erica Otiono, Associate Director. I hope your Easter, spring break or spring break was a good one, and that you had a little me time to rejuvenate. Once again, thank you for joining this webinar and for your continued work for children and families. We hear that many distance learning programs are returning to in-person. Exciting. Thank you so much. We really, really appreciate your efforts. And for those programs that didn't stop in-person services, thank you. As you know, the Program Quality Implementation Office, we call ourselves PQI Office. We are responsible for monitoring, training, technical assistance, and contractor support. Later in this webinar, I will provide you with some updates and reminders from the PQI office, so stay tuned for that. I want to end this intro by saying a special thank you to all members of this webinar team. You rock. Enjoy the session, everyone. I'm going to turn it over to you, Virginia.
Hi, everyone. My name is Virginia Early. I'm the administrator of our policy office in the Early Learning and Care Division. I thank you so much for being here, for your engagement in our policy process. We're working very hard here, both to inform any new legislation and policy as it's being developed with the governor, the administration, and the legislature, but then also to work on areas where we know the field needs more guidance around implementation. So thank you for that. And one piece of where we get to work across the state, the governor's administration with Department of Social Services. So we're very happy that that we have representatives from the Community Care Licensing Division on this call, and I'll turn it over to Shauna so you can introduce yourself.
Hi there, my name is Shauna Wynn-Swan. Sorry about the delay. I am one of the assistant program administrators of Child Care Licensing. And I also have two of my staff that have joined us. I don't know if they're able to introduce themselves or not. If not, you can always introduce yourself via chat.
Good afternoon. My name is Jeff. I'm an analyst with the field support.
Good afternoon. My name is Chris Locke, and I am the manager over the legislative unit in the child care program.
All right. So do you want to say anything else, Shauna, or should we turn it over to Alana, who is our moderator?
I do. Thank you. Thank you, Virginia. I just wanted to add our voice to the chorus of those who we definitely stand opposed to those acts of violence, and again, want to express heartfelt unity with the Asian American Pacific Islander community. We also know, as Stephen mentioned, that these are really challenging times, not only in our state, but across the nation, with the trial related to Eric Garner's death. But I do remain hopeful, very hopeful that change will come as we begin to have more authentic and brave conversations that will hopefully spur each of us to action against hate, racism, and implicit bias. So thank you for bringing that up again. It's so important. Would you like me to go into, are we diving right in?
Yeah, no, we're going to turn it over to our moderator, Alana Andrade, right now. Thanks.
Thank you.
Good afternoon, everyone. I'm a child development consultant at the policy office here at ELCD. And as I'm moderating the webinar today, as usual, we have a wonderful team answering questions and making this presentation run smoothly. From the policy office as well, we have Danielle Davis, Eric Dunk, and Barbara Lindsay. From the Program Quality Implementation Office, PQI, we have Deborah Rawson, Lupe Lopez, Cassandra Lewis, Brittany Sheffield, Yer Zong, Richard Miller, Serene Yi, Christina Tony, and Katina Boulay. From the Child Development, Nutrition, and Fiscal Services Division, CDNFS, we have Andrea Johnson, Corey Kahn, and Alan Lynch. And from the Child Development Management Information System, CDMIS, we have Robert Hom and Carly Notohara. And from CDSS, we have, of course, as who just introduced themselves, we have Shauna Wayne Swan and Christopher Locke and Jeffrey Lane. And our team, as usual, is committed to being as responsive as possible. And just to reiterate, our team will not be able to answer every question received today. We do appreciate being able to engage with you. And also do note that our chat box is disabled. Our wonderful Brittany will be able to send links out to you, but you will not be able to chat with us. So please use the Q&A feature in order to ask your questions today. And now I'll back over to Stephen just to review the agenda.
Wonderful. Thank you, Alana. I'll try to move quickly through the agenda so we can get to the good stuff here. So as you can see from our agenda, as we normally do, we've got many things to cover. Since our last webinar, of course, things continue to happen, such as kind of the nature of the work and definitely no doubt the pandemic. And today we'll be covering out of our policy office some updates on some items related to the funding and guidance. Fiscal will cover some stipend allocations, and then PQI has some updates as well. Also looking forward to some items from our friends from the Department of Social Services. After that, we're going to review some of the questions that have come into the emergency email box or may have come from you outside of the emergency email box. We're going to do our best to answer as many questions as possible, but whatever we don't get to, we'll provide answers to as FAQs on our website. And I'm going to ask Virginia to rejoin.
Thanks, Steve. So I think many of you have likely seen this slide before if you've attended our past webinars. So there are three management bulletins that we continue to work on. They've been a little bit trickier than we expected, and we're really wanting to make sure that we're sort of being very thoughtful to make sure that we don't create unintended hiccups with the guidance. And so we just wanted to give you all an update on where those are. They're not out yet. We had hoped that they would be by this point. But just in terms of upcoming guidance, as a brief reminder, we've got these three different bullets here. The first one is going to be covering extension of emergency childcare services and new enrollments in emergency childcare, both for essential workers and at-risk populations. So that one will be implementing the pieces from the recently passed legislation that provided additional information about that. That one will be rescinding and replacing Management Bulletin 2014. The second one on this slide is an update regarding reimbursement and data collection requirements for alternative payment programs and providers, non-operational days, and really focusing in on those non-operational days for closures related to COVID. So there are those additional non-operational days. This will cover specific to the AP side of the house. And then we'll also, the third bullet here, will be covering the non-operational days for closures related to COVID-19 for direct service contractors. And so that will be rescinding and replacing Management Bulletin 2018. So we're getting very close to finalizing these through our processes, and then for all of the guidance. We also have to notice it to the union as well before we post it now. That's part of our new process. And so we hope to have these out shortly and hope to have much more information to share with you on our next webinar about the contents of these management bulletins. So I will now turn it over to Erica for our program quality implementation update.
Yeah, thank you, Virginia. So Erica Otiono again, just giving you a quick update from the PQI office. You remember we do monitoring, we do training, technical assistance. So on the slide, you see we have information on all those elements. So for monitoring is about reviews. The reviews are going very, very well. Want to say thank you to all of you for being so flexible in terms of the our new monitoring system. It's has some few challenges at the beginning, but it's flowing very well. Thank you so much. Few reviews had to be postponed to May. So I'm very glad that those are able to happen in May. The reason we do monitoring is about accountability, and we're required at the end of every fiscal year to do a report to the governors, to the legislature, and to the governor's office. So happy that we're going to be able to do that this year also. So thank you so much for your flexibility with the new innovative uploading of information to zip file and so on and so forth. Also, as the other part of what we do at PQI is training. So for this fiscal, the rest of the months before the end of the fiscal year, we just have 2 of them. We call that training webinar Wednesdays. So we have one coming very soon, April 14th, scheduled from 10 to noon. This is going to be focused mainly on completing the program self-evaluation, which you know this year is looking different, very exciting. It's all through the SNAP survey. So hold on, I know some of you have already, maybe 2-3 agencies have already submitted. Yes, I would say hold on until after the training to submit your program self-evaluation. So stay tuned, April 14th. Put it on your calendar, 10 to noon. You will receive the invitation shortly. I think by tomorrow, we should send out the information to you. Right after that in April, we're going to, hopefully we don't intend to have anything in May. That will give us time to conclude our monitoring and also be able to plan for this great one, tentatively scheduled for June 9th. Stay tuned. It's going to be a combination of end of year celebration with the field, with contractors, and also like saying goodbye, because after June, by July, it's going to be, some of us will be at CDSS and some of us will remain at CDE. Great planning already going on right now. It is very exciting. So we may be reaching out to you for some added information, but we're planning and really planning that. So going away. It's a goodbye celebration, tentatively June 9th. So stay tuned. We'll send out information as soon as we firm and confirm everything. Thank you. And we're hoping it will be about a 90-minute session. We need full 90 minutes for that celebration. Technical assistance, the consultants are doing their regional cafes. Regional cafes is something that we have been doing for a very long time. We just renamed it. It's called clusters. So regional cafes can happen from agencies asking questions, and consultant will decide, okay, I need to pull some of the 3, 4, 5 agencies or my whole region together. So regional cafes are going very well. I know I've heard about the one in the south, one in the north, One Central. So great. Regional cafes are going very, very well. So those three are the quick updates that I have for you. But finally, just one quick reminder, you know, every year, all contractors are required to submit their fiscal annual audit. The audit, because of the pandemic, is usually due, depending on many agencies, November 15, depending on your cycle. It was extended by 3 months, meaning February 15. So we still have quite a large number of agencies that have not submitted their audit. So please, as we go back, as we end today, go back and check with your internal audit department or fiscal to make sure that you have submitted your audit. It's very essential. We don't want anybody to be on the withhold list at all, no. So please, please, if you can go back and make sure that you have submitted your audit, that would be highly appreciated. And I know that consultants are also reaching out to some agencies to make sure. Okay. We're trying to be proactive. We don't want any withholds at all, because you know, consequence of not having your financial audit report is withhold. So we don't want to go there. So that's quick update from the Program Quality Implementation Office. Remember, we are always here for you. Continue to work together to enhance and support children and families in our communities. Thank you so much. Alana, do I hand over to you or hand it over to fiscal?
Hi there. So we're going to invite Corey to speak. So it's going to be for fiscal.
Thank you so much. Okay.
Hi, everyone. My name is Corey Kahn. I am a manager within the Child Development and Nutrition Fiscal Services Unit at CDE. So I'm going to provide over the next 3 slides just a few updates that we've talked about over the last few weeks. And the first one is in regards to an amendment that we are going to be releasing. So as we discussed in our previous webinar, the CDE will be releasing alternative payment program contract amendments for several purposes. And so it's a single cap amendment that will be sent to contractors on or around April 16th for the following purposes. And we've also listed the fund source next to it as well. So the first purpose is emergency child care extension. So that's through June 30th, 2022. And this allocation was funded with CRRSA funds, which was the Coronavirus Response and Relief Supplemental Appropriation. Also, CRRSA funds funded new slots for emergency child care. So that will be included in this one amendment that you'll receive. Any non-op reimbursements that are due to the agency, that has been funded with CARES, which is also known as the Coronavirus Aid, Relief, and Economic Security. And then there will be also an additional augmentation for those that have reached out to us for paying at the maximum certified hours of care. That is also funded with CARES funds. And then also, it's not a funding, it doesn't increase your funding, but we will be including for CAP contracts, contract extension. So we'll be extending the period of performance for all contractors through June 30th, 2022. So that's to, you know, in the past, we've had multi-year contracts for CAP contracts. So that's to extend the CAP, the fiscal year 2021 contract for another year to make it a multi-year. So what we reported last week actually was also, we were going to include another purpose within this amendment, which was for adding Prop 64 funds to your contract. And we have chosen to actually remove the Prop 64 allocation from these amendments that will be received around mid-April, as we don't have access to the Proposition 64 funds yet, and we didn't want it to delay the release of all other allocations. So as we've done with other allocations, fiscal analysts will also be sending you all an email, all the CAP contractors, an email notifying contractors of their allocation amount that you will receive for each of those purposes that I just went over. And that will also include the amount that you'll receive for Prop 64, but it just won't be in this mid-April amendment. So all CAP contractors should receive this email by the end of this week. And this email, like I said, will include the Prop 64, even though we don't have those funds yet. So we will continue to provide you guys an update on the status of those funds as we receive additional information. We just wanted to get the amendment, the amount that you'll receive out there to you. Okay, and then the second update is around stipends. So on March 25th, 2021, the CDE released an email titled Assembly Bill 82 Stipend Guidance to those subscribed to the Early Learning and Care Distribution List. And this guidance provided information to contractors on the appropriate use of stipend funds and the timeline for distribution. And so CDE, our update is that CDE has approved all vouchers and has requested an issue date of Friday, April 9th, 2021. So contractors can therefore expect to receive their stipend payment probably the week of April 12th. Funds provided via an apportionment payment to local educational agencies, LEAs, which includes charter schools. We are required to distribute them to the county treasurer's office. And so the LEA should contact the county treasurer's office to coordinate that transfer of funds. So as stated in our guidance, contractors are to release stipend payments to childcare providers within 30 days of receipt of their check. So for example, if a contractor receives their check on April 14th, the contractor must in turn provide the $525 per child stipend payment to all providers by May 14th, so 30 days after receipt. We do understand that there are some circumstances in which we need to collect additional data to ensure all providers with subsidized children enrolled in November 2020 receive a stipend. And so this really includes like the CalWORK Stage 2, Stage 3, alternative payment and migrant alternative payment contracts. So those children who were enrolled that might have received care from 2 providers or multiple providers in November, we're collecting additional information on that. You should have received an email from your fiscal analyst last week requesting additional information that identifies children who have multiple providers in November. So again, that only applies to CalWORK Stage 2, Stage 3, alternative payment, and migrant alternative payment. We do understand that there are other contractor-specific situations in which additional information needs to be provided to us to ensure that all providers who had subsidized children enrolled in November receive an allocation. And so if you have a circumstance in which additional funds need to be allocated to ensure all providers receive that stipend that serve children in November, please also reach out and be sure you just reach out to your fiscal analyst as soon as possible. And then the third update that we wanted to provide was around a survey that we will be conducting. And the Child Development Nutrition Fiscal Services Unit, so we will be releasing a short survey to all alternative payment contractors to collect data which will inform the state's understanding of variable schedule enrollments. So specifically, the survey will ask for the percentage of children enrolled with a variable schedule and assess how much of the allocation your agency received for paying providers at the maximum certified hours of care is projected to be spent by the end of this year, so by June 30th, 2021. So we're hoping to release the survey this week, hopefully tomorrow. And then we're gonna ask for request a due date of April 15th, 2021. And so again, this is going out to the alternative payment type contractors. And so that will be forthcoming. And so that concludes our fiscal updates. So I'm going to hand it over to Shauna from Department of Social Services to go over some, I believe, frequently asked questions.
Thank you, Corey. Right, so as you see here from the presentation, we've received a lot of questions from the field regarding the cohort guidance. And we did discuss it in the last webinar, and we just wanted to provide an opportunity to respond with more answers to some of those frequently asked questions that everyone's asking. And so first I'll ask Brittany if she can please drop the link to pin 21-08 in the chat box or the Q&A. Okay, so question 1 is, do contractors operating in a county within the red tier need to have the 16 cohort limit? And so the answer is only the purple tier. So if there's a county in a program that's residing in a county that's in the purple tier, then you would adhere to the cohort size. And that's for licensed and license exempt childcare providers located in those counties as being widespread in the purple risk level. You would follow the guidance for small cohort and groups of children and youth issued by California Department of Public Health. And we can also add that link to that document in the chat box as well. The second question is, the Center for Disease Control and Prevention released guidance for schools to keep 3 feet distance rather than 6 feet distance. Will licensing be updating this? And in PIN 2108, the only language around 6 feet is in relation to the cohort and groups. So that means if you have a cohort or a group, it should be 6 feet apart from the other groups. And that's the only reference that we have in PIN 2108. So we didn't get as specific, but of course, staff would, staff should stay, remain 6 feet apart from other staff to the best extent possible. And I always say the 3 W's, right? Watch your distance, wear your mask, wash your hands. Let's see here, next slide. Hey, another cohort question. Does a cohort include teachers or any other adults? And a cohort includes up to 16 individuals. So it could be a combination of adults and children. And then the last question, and this is a really popular question, and it's very specific. Can we return to our class size of 24 with 3 staff? Is there a maximum number of children allowed in a room? And that question is really specific. And so each program is different, and it's really difficult to get into the specifics of each program because each county might be on a different tier, or your program might look a little bit different. If you're not, I think what's important is that children should remain in groups as small as possible, and that's always been our childcare industry guidance. So if you're not in that widespread tier, then you'll just want to make sure to follow your county guidance, but then also your program may have something different. So what we have been sharing and messaging, and from the very beginning, is children should remain in groups as small as possible. Should those guidelines differ from local health ordinances, you'll want to follow the stricter guidance. So the state is silent on small group size, and it's a programmatic decision based on your county guidance as well. So your county guidance might say, it might refer back to the childcare industry guidance where it says small group size, and then that would be a programmatic decision. So we hope that answering these questions on the webinar today will be helpful. And my team and I, we will be looking through the chat box to see if there's any other follow-up questions. Thank you.
Okay, well, thank you, Shauna, for going over some frequently asked questions. And yes, there are some questions for DSS in the Q&A chat. So feel free to start answering. I know our attendees are very excited that you're here on this presentation with us. So let's see, there's a few open questions that I would like to have answered live. So one of them is regarding audit. So I'd like to ask that Erica come back and speak a little bit. I think those listening in heard the word audit and then started to get a little bit, they had a lot of questions. So can you describe again about the audit? And a lot of them were asking more about like how to get in contact with the audit division as well. So
Yeah. So let me answer that. Again, I'm going to turn off because I don't want to be cut off in between. I'm just going to turn off my video. Sorry. My internet is telling me I'm unstable. I'm stable personally, it's just the internet. So the audit, if for those of you that like regulation, so it's in Title 5, 18071. 18071. It says that contractors shall submit to the Department of Education an acceptable annual financial and compliant audit. It has to be done by CPA, licensed in California. School districts, the audit goes to the State Controller's Office. Non-school districts mail to the CDE. It's typically due November 15th. It's because of the pandemic, it was extended to 3 months. So it was due February 15th. You don't have to call CDE, no, if you have submitted or not. Consultants, they received a list. There were about 60 something agencies or more that have not. Consultants will reach out to you. So if you have not submitted, to make sure that you submit. So though you don't have to reach out to CDE audit, and no, you don't have to. So we're thinking of sending e-blast to the whole field, but we decided to kind of put that on hold a little bit and just reach out specifically to agencies. So again, that is the audit that is being required. It's in Title 5, 18071. Non-school districts send it to CDE by November 15th, in this case, February 15th. And then school districts sent to the State Controller's Office. So many of the ones that are pending are from non-school districts, so non-LEAs. So you should be receiving, if you have not. I know some consultants have already reached out to you. We're going to update that list by Wednesday and then send, because some audits have already arrived since the last time we received the list. We'll update and we'll resend the email to you. So if you have any questions, please reach out to your consultants or to me. It's fine, me or any of the PQI admins. We're just trying to be proactive. Thank you. Thanks, Ms. Alana.
thank you, Erica. Okay. So there have also been a lot of questions regarding held harmless and if contractors will be held harmless in the next fiscal year. I would like to ask if Virginia or perhaps Corey could speak to that.
Yeah, thanks, Alana. This is Virginia. So we know that this is top of mind for so many of you. And so just wanting to address that, I answered some questions in the Q&A, but the bottom line is for these pieces is that the statute needs to be changed. And so that requires legislative action. So I wish I had a crystal ball and I could tell you what the legislative action will be, but those conversations are still ongoing. And we urge you all to get involved in it. And specifically, it's Education Code Section 8209F, which would need to be amended for the direct service contractors. And then there would also need to be something for vouchers as well. So really just knowing that these are things that we've brought up at all the budget hearings when CDE has testified before the legislature. About the budget as being a top need from the field, but it's not an area where we have a magic wand at CDE to do things without legislature taking an action. So we're very hopeful that they will, but we can't tell you what's going to happen until there's something that's printed in a law and signed by the governor. So that's the point that we are at. So if this is something that is of concern to you, as I know it is to many, we'd urge you to get in touch with the budget and policy committees of the state legislature, provide public comment in their hearings, send letters to them, send letters to your representatives, the governor's office, the administration. So keep us posted about what the needs are from the field, as we like to elevate those in our conversations with them as well. But we want to just be clear, you know, based on the state's constitution, we do not have the authority to change the law ourselves at CDC.
Thank you, Virginia. I'm going to hold this closer to my mic closer to me because now there's some leaf blowers outside. Forgive me. And so I have a few questions that are outstanding, and I'd like to ask our CDSS partners to speak to. There's a lot of questions regarding about ratios in the fall and as they're trying to plan for the next fiscal year. So if we're going back to full ratios in the fall, do we start in the summer too, or do we actually start in the fall? That's one question.
Hi, this is Shauna. Can you repeat the question, please?
Sure. So one question is asking that they're about to go to the full ratio in the fall, and do they start this process in the summer too? I'm assuming that means June 30th to July 1, or do we wait until the fall itself?
May I ask what ratio they've been operating in, or are they actually, is this a facility that was closed and now they're reopening?
I don't have all those. What I have is, do we still limit, do we still have the limit of 16 staff and students?
Okay, thank you for the clarification. So that's a good question. The 16, that's the cohort group size for those counties that are in the purple tier. But ratios and ratios, your standard ratios and regulations, that has always, depending on what program you're in, if your ratio should still remain the same. It's it's separate from the group size.
Okay, thank you. And Shauna, there's a lot of questions regarding 6 feet versus 3 feet. And I think a few of them are citing that there's a local public health guidance that has 6 feet, or is it the 3 feet now?
Right. So what we've always shared with each program is you need to look at your local county guidance, and we can put that in the chat box, because each county could be different and you'll want to follow which guidelines are most strict. And I will say, like, the 6 feet distance for childcare, it's related to group size, like your groups, not your group size. I'm sorry, it's related to groups, keeping children to the best extent possible 6 feet away from other groups or other cohorts. And I thought, but I could be wrong, so please correct me. I thought the 3 feet was specific to individual children in the K through 12. And we haven't updated anything of that nature as far as individual children. We know that children play together. We know that programs are doing their very best to implement COVID guidelines and do their health screenings with staff and children. And so our guidance in PIN 2008 only specifically touches upon keeping groups of children or the cohort or the group distant 6 feet distant from the other group. I hope that clarifies.
Thank you. And I also have another question for you, Shauna. So there's a few questions coming in about vaccinations and how that might have to deal with the childcare licensing immunization form. And if that's something that CDSS is considering, is that something they need to consider right now?
Sorry, I'm trying to catch up with all of the questions here. I don't see that one. I'm sure it's in the chat box, and I'm a visual person, so I'm trying
Oh,
to.
sure. It's Beverly Taub at 236.
Okay, so we use parent volunteers every day to meet ratio in preschool. We follow SB 792 for immunizations and TB for the volunteers, but what about COVID vaccine? Will that be required as well? So the department licensing hasn't made any, we haven't made a requirement for COVID vaccines. If a program is requiring that, that's done at a program level, but I would say that that would be something that they would need to have. It really is based on the employer, but the department and licensing has not made any requirement for a COVID vaccine. But again, if a program is going to choose that option, it would be imperative that they would have that updated in their program operations manual and their parent handbook. It's a very good question.
Okay, and there's a lot of responses saying, thank you for the clarification verbally. So it's always good to make sure that everybody understands.
Yes,
Let's see.
yeah,
So
recognize it's a lot to, digest with the different guidelines from the county, the state, and just different agencies. So yeah, thank you.
absolutely. Okay. So there was a question regarding interagency transfers and funds between CCTR and CSPP once the transfer happens. So I'd like to invite Corey to come back and speak on that.
Yeah, so we had a question come in about whether the department was still going to do CSPP, CCTR transfers, but for non-LEA contractors this fiscal year. So typically that transfer, intra-agency transfer does occur between May 1st and May 15th. So to answer the question in short, yes, we're still doing them. However, we are going to be probably issuing additional guidance or information shortly, because we are going to be moving that period up just a little slightly, I'd say a week or two prior to the normal period. So that should be coming up. And that's just to ensure that we get all the contract amendments processed prior to the end of the fiscal year. This year is especially important since we want to get them all in prior to the transition to DSS. So that's part of the reason why we're moving it up just a few weeks. So look out for more information on that. So that was what I wanted to say live to everyone in case anyone didn't see our response.
It's always worth reiterating. Absolutely. So Corey, there is a stipend question. Someone wanted a clarification and a confirmation about stipends received must be expended within 30 days of receiving those funds.
So stipend, so it depends. So stipend in the guidance that was released on March 25th, it does say that stipend funds must be expended by June 30th, 2022. However, what we were talking about the 30 days was that if you have to pass that stipend on to a provider, you have 30 days to pass it on to the provider, if that makes sense, from when you receive that check.
I'm scrolling through. I see a lot of our Q&A team is currently answering questions, so I don't want to call on them while they're trying to answer your questions. So I'm trying to pick one that has been showing up. So Shauna, there are some questions regarding the cohort definitions when tiers are shifting between different colors. Is there a way that you could speak a little bit about how that would look if there's a county that's moving from, let's say, the red tier to the purple tier, or I forget which spectrum of the rainbow we're on right now.
Hey there, Alana. So can you restate the question, please? Like what it would look like for a program if they were having to move between tiers?
Correct. I'm kind of synergizing lots of questions about this instead of calling out a specific one.
Right, yeah. So the state is, if your program's not in the purple tier and you're in another colored tier, and for some reason there's a surge or a spike and you have to go back into that purple tier where the guidance is the cohort of no more than 16 individuals, I think what's important for programs to keep in mind is to always have a backup plan, and then also understand the childcare industry guidance has specifically said small group size. So we just always have to keep that in mind. The state is silent on that number. We're not going to tell you what that number should be. It really is look at your county to see if your county has specific guidelines for that group size. And if it isn't, then that's a programmatic decision.
Okay, thank you. So that time is gone a little quickly. We're almost at 3 o'clock. Let's see what else we can do. Looks like there are folks that are responding to an answer, so I don't want to type it out loud. Let's see. It's more about cohort questions, but Shauna just responded to a lot of the tier questions. The questions regarding 6 feet and 3 feet have also been identified and answered. There is a question regarding guidance. I think John Moon's question, what would be the guidance for preschool children? The panelists mentioned only K through 12. I'm kind of unsure about where that's coming from, but the guidance that you spoke about, Shauna, was about childcare, which is what we're here to talk about. So there are a few questions about stipends coming in, so I'm going to call on Corey to come back. So one question was, what do contractors need to know what the providers are spending the stipends on?
I mean, I don't think our guidance specifically addressed that, but that the stipend is to cover any additional costs that they may have incurred, previously in the past, for any of these increased costs related to COVID expenses. So I don't really have a specific answer on that, but it should be to cover those costs. Virginia, do you have anything?
I think I've been looking at the same questions as well. So I see one on, do they have to collect receipts? And are there certain allowable expenses and other expenses that are not allowable? What's that sort of oversight? Are contractors responsible for how providers spend stipends and those pieces? So I think Alana was trying to synthesize those into one, but just to give you a little bit more texture. It seems to be that's where those questions are coming from. So is there any?
Yeah, we can take it back. I know that the stipend guidance did put some information for, it was really probably directed towards center-based contractors who don't use providers, but that the stipend is going to them directly. And so, in this guidance, it says that you still will be subject to audit requirements, just like any other state or federal funding. And so you'll have to ensure that you track these expenditures appropriately, which includes, and not limited to, maintaining records for payments to providers, so your actual payment to provider, and all like purchase orders or receipts that you spend it on. So that you're verifying that you spent it properly or accurately. But we'll take it back in terms of, I mean, I don't believe that you would take you would ask the provider for receipts once you've passed it on to them, but your records on who you paid need to be on file at your agency, but we'll take it back as well. I would assume that the provider should keep that record, but I'm not sure if you would have to collect it, so.
Excellent. Thank you. I appreciate both you, Virginia and Corey. There is also a question about a reporting of attendance for Q3, as this is a district that just reopened. Should the attendance be just at what we've been doing? So should the attendance for in-person only be reported? I think that would be for you, Corey.
Yeah, so I think it was Management Bulletin 2015. That's not right. 2018. There's a management bulletin out there about reopening requirements, and it does outline how to report days of attendance and days of enrollment for fiscal year 2021. Oh, it's 2018. Sorry. So also there's some older webinars that we have posted. I know that they are posted that go over how to report attendance and enrollment. Pretty much for attendance, if they are attending care, you're only going to report those that are attending care, actually attending care. For enrollment, though, you're going to report all children that are enrolled in the program. But those are your resources, is MB 2018, and then looking at older webinars from probably the fall time that have been posted, because I know we did a lot of charts and stuff during that time.
Yes, we did. And they are on the ELCD FAQ page, so please take a look at that. There's over 300 questions, all there for you to make sure that you understand as much as possible. And so I think we're going to start closing out our webinar today. We do still see a lot of questions regarding the tiers and the cohorts, so we'll definitely make sure that that's taken back. Please reach out to your CCL analyst and reach out to your PQI consultant for any of those questions that are left unanswered today. Okay. So the ELCD COVID-19 guidance webpage at https://www.cde.ca.gov/sp/re/ELCD COVID-19.asp is a place where you can find our webinar slides and transcriptions, management bulletins, and the frequently asked questions that I just mentioned. You can always submit questions to the ELCD emergency email inbox at elcdemergency@cde.gov. To reach your assigned PQI regional office consultant, please visit https://www.cde.ca.gov/sp/cd/assignments.asp, or by calling 916-322-6233, where you can reach the consultant of the day. Just to note that consultants are can be more easily reached by email. And now back over to Erica and Stephen to close this out.
Thank you, Alana. On behalf of everyone on this webinar team, I want to thank you all, everybody, for participating again. Let's continue to take care of ourselves and others by wearing masks, maintaining the physical distance, and washing our hands. Stay safe, and thank you, everyone. See you on the 14th for the program self-evaluation webinar. Over to you, Steve.
Great, thanks, Erica. I'm really glad we were able to get to more questions today. We had nearly half of our time dedicated to questions, so that was nice, and I'm glad that Shauna and her team from CDSS were also able to join us to answer many of your questions. There's still many more, but to close this out here, just on behalf of all of us that continue to work to support children, families, and provider professionals, we want to thank you for taking some time out of your Monday afternoon to participate in this afternoon's webinar. We hope you'll join us for our next webinar on Friday, April 16th. Please take care of yourselves. You are vital to our shared success in getting back to normal. We at CDE will continue to do our best to support you as you support children and families. And just thank you, and we hope we'll see you next time.